I'm here at the Kent, Surrey, Sussex Education Conference. It's a real pleasure to be here. The theme of the day is disrupting the ordinary. The Health Innovation Kent, Surrey, Sussex team is running workshops within the Innovation Lab session. It's important that educators have skills and understand the importance of innovation, as well as understand and have an opportunity to look at the use of AI and digital technologies in medical education itself. Look forward to the day ahead and some of our workshop sessions, and we'll be sharing some reflections at the end of the day. I'm here with Dr Michael Horbury, Associate Dean at Kent, Surrey, Sussex Deanery, and Child and Adolescent Psychiatrist at Sussex Partnership Trust. Hi, Michael.
Hello, good to be with you. Hello.
I love that you have an innovation lab theme to some of the workshop sessions today. And we'll be covering things like digital and AI and innovation and entrepreneurship,
yes,
low-tech simulation and low-fidelity simulation. All of these are important tools for educators and actually learners as well.
Yeah, absolutely. And I think we're seeing lots of evidence of the impact of new ways of working in a digital space and in AI. But as a working clinician, as a child psychiatrist, I'm not quite sure how I translate some of those examples of great practice that maybe I've read about or seen in other services into where I work in my trust, and I suspect that might be a challenge that many other colleagues are facing.
So I'm leading a couple of workshops on digital health, entrepreneurship and innovation, specifically in healthcare, but specifically as it applies to medical education, because we know that pretty much all the attenders here, delegates here, are involved with medical education in some capacity, either as educators or learners. And so the workshops that I'm running draws upon the Biodesign Fellowship. So I had the fortune of doing the Harvard Health Tech Fellowship a few years ago, which basically applies the biodesign framework, which is a proven model for innovation in healthcare, breaking it down into stages such as identify, invent, and implement. And we're applying it across a series of vignettes of challenges that educators commonly face. So that's things like competency tracking, practicing for written and oral examinations, and the stress that educators experience when it comes to doing the workplace-based assessments for their trainees.
So today, the theme of our workshop mainly is about digital literacy and a bit of a practical workshop on trying to get people to use Copilot, which we all have access to as NHS users.
So we started off talking about in 3 different parts. AI and education, where it's going from, the NHS England framework that's being developed now as well, the ideas about where it leads, the role of an educator, and there's a big question mark about the role of a subject matter expert when we have ChatGPT that is a subject matter expert, and how the role of an educator brings the human back into the loop. And then Ashwari done a brilliant session on prompting.
Essentially, initially, I tried to build an app to help my students with clinical role play and for them to be able to test and practice their consultation skills. And then I realised actually this app was actually very useful kind of more widely. So we're looking to kind of move forwards and commercialise it as well.
Yeah, and tell us about the app. It's something that you've been demoing on the day-to-day at this conference.
Yeah. So essentially, it's a clinical simulation tool that uses AI to generate virtual patients for clinicians to practice. They can talk to the patient live, they can ask them questions, they can do clinical examinations, they can ask for diagnostics to be obtained.
An incredible day at the KSS Education Conference. A real pleasure to catch up with educators, to see some of our own team and clinicians that work with us, engage with them and do sessions around AI, medical education, entrepreneurship, innovation, biodesign. And for most of all, these skills, these ways of thinking are critical to shaping the future of the NHS and the next generation of clinicians, and also taking on some of the recommendations that the Health Innovation Network made with the Academy of Medical Urologists in its report last year, which we will share with the video. As ever, look forward to any feedback, and I'll see you at the next episode.